All right, so thank you to everybody that is here. So we have Larry, who's going to be facilitating this meeting, and the goal, Larry's going to talk about it, but the goal is that we want to get the Galactosemia community's input on kind of a few of different things that are going on right now with FDA and accelerated approval, and wanted to get thoughts on treatment moving forward, and a number of different things. So our goal at the end of this is that we're able to kind of look back on this video and look to see what the feedback is, and write a letter to the FDA where we can also include community members' feedback and get quotes. So the quotes that we're going to be using will include just your first name, and we'll go from there. So I'm going to mute myself.
Great. Well, thank you everybody for taking time out of your day. I'm sure you guys are all pretty busy people, but this is really important for the Galactosemia Foundation and for your community. As Nicole said, we are going to listen to you today, listen and learn, try to get your perspectives on a variety of issues. And the purpose of doing this is that we wanted to be able to communicate with the FDA about what do people living with galactosemia, or their caregivers, what do you guys think about some of these issues? So the way we're going to do it is, I have several questions that I've prepared, and, we'll just kind of go through them, and I hope that you all participate and share your stories. But before we start, let's do introductions if we could. Just so you know a little bit about me, I work at a law firm called Hyman, Phelps and McNamara, but I'm not a lawyer. I used to work at the FDA in the Rare Diseases Program. I was one of the founders of that program. I was there for 10 years, and then I went into private practice, and I mostly do kind of consulting, and most of my work is focused on working with patient organizations. And I'm really interested in trying to bring the patient voice and patient opinions into drug development. So many times in the past, new drugs or new products were developed, and they were just developed by scientists and doctors by whatever they thought. And the patients with a certain disease, or the end users, actually their opinions are the most important opinions when it comes to developing drugs. So the FDA has really over time come to value patient input, both at the beginning of drug development as well as when they get a new drug and they have to review it to just make a decision whether they approve it or not. At the early part of drug development, the FDA is the organization that reviews any new study that a drug company wants to do. And if they want to test it in human beings, you can do animal studies without going to the FDA. But once you want to give that drug to a human being, you have to first go to the FDA with information about, how have you studied this drug? How do you manufacture the drug? How are you sure that every dose is exactly the same? And why is it that you think that it's going to work in this certain disease? And what kind of safety studies do you have? What do you think this drug's going to do to people? Every drug has its good side, that it does things to help people, but every drug, as we all know, has downside side effects, things that it could do off target, that the FDA has to be very aware of this, because FDA is the final group that makes a decision whether that drug ends up on pharmacy shelves and whether a doctor can prescribe it. If they get it wrong, people could get hurt, so they take their responsibility very seriously. So before we'll be listening to each other, for this time we have, but I'd like to get to know at least just a little bit about each of you before we start. Are you someone living with galactosemia? Do you have a family member or a child with it? If so, how long? Maybe where you live, or anything you'd like to share about that. So if we could just kind of go around the screen, I'm just going to call on people as they show up on my screen. So Kimberly, you're the next one on the top of my screen.
So I'm Kimberly Malin. I have galactosemia. I'm 46 years old, and I I live near Kansas City, Missouri, but I was born and diagnosed with galactosemia in Texas.
Okay, thanks. Amy?
Hi, I'm Amy. I live near Salt Lake City. We are originally from Kentucky. We have a 6-year-old child who has classic galactosemia. And, you know, he has most of the typical symptoms that a 6-year-old boy would have.
Okay, thanks. Donald?
Well, I'm a grandparent for 2 boys with classic galactosemia. Noah, age 3, has, I would say, tremors and speech delay at this stage. Carson is just 1 year old, and we're not really sure where he's going to ultimately sort out. I spent my career in the medical device industry. I've spent a lot of time with the FDA. And you know, I agree with everything, Larry, you were speaking about. They do take this very seriously. I don't have the experience on the pharmaceutical side, and they're very different, but there are some commonalities. I also will just kind of volunteer. I have a pretty good, because of my age, I have got a lot of years in the industry and a fairly large network. And I've also been able to reach out to not only applied therapeutics at a very senior level, but also spoken with both the founder and the CEO of the 2 other genetic therapy companies that are working on drugs. So to the extent I can, I'll try to keep everybody tuned in, you know, as the years progress on what I'm hearing on these things. So thank you for including me.
Sure. Yeah, that's important to stay connected, Donald. Just a reminder for today, though, we really want to be hearing from you as a grandfather to Noah.
Oh, absolutely. Yeah. And I'm very involved with the caregiving as well.
Great. Awesome. Okay. Trisha?
I am from Central Illinois. I was born in Springfield and now I live on my own in Peoria. I'm 27 and I have classic galactosemia.
Okay, thanks. Tara?
Hi everyone, Tara Tinella. We live in New York and Long Island. My son, Joseph, Joey, we call him, he's 11 with classic galactosemia as well. Joey was diagnosed day 3 through newborn screening. He follows similar, similar common symptoms of, classic galactosemia, with kind of the exception of seizures and cataracts. Academically really struggles. We're seeing the big impact at this stage of the game on the neurological component related to kind of Joey's journey. So I'm a big advocate in that area at the moment. But yeah, that's our story.
Okay, thanks. Kelly?
Hi, my name's Kelly. I'm a grandmother of 2 grandchildren. I have custody. I've been raising them since they were born. They're now 10 and 11. My granddaughter's the one that has classic galactosemia. And since she was a baby, I got her into, we learned early on. She's probably a few weeks old when I learned she had, but at first they thought it was, it wasn't classic. They thought it was something else, more milder galactosemia. But I'm probably one of those, I've always been one of those moms that's like, nope, we're going to go all the way. I want all the testing. I want all that. So I had some DNA testing done. That's how I found out she had classic, because I just kind of knew something else was going on with her. But I got her right into first steps and did all the things that she needed to get her, start in life. I was told that she would be behind in learning and walking and all those things. But of course, me being me, I'm like, nope, not going to have that. I am very grounded in my faith. I believe that.
Oh, we lost your voice. Kelly.
There we go.
There we go.
So she's doing well. She is behind a bit in school, but she has a lot of behavioral issues, which is my main concern, is that she has a lot of behavioral type issues, some cognitive and learning issues as well. She had a lot of bone issues, bones popping out of joint and that kind of stuff. And so I'm still learning. I'm still following everything and anything that I can learn to keep up with the trends and things like that. So it's been a interesting journey.
Okay, thanks, Kelly. Heather?
Hi, my name is Heather Sharp, and my husband and 3 children live in Ottumwa, Iowa. All 3 of my children have classic galactosemia. My oldest is 23. She was diagnosed at 5 days with the newborn screening. Our 2 boys are 20 and 16. I had an amniocentesis with both of them, so they were diagnosed prenatally. The issues that we kind of have, our daughter, the premature ovarian failure, which is what they called it when she was younger. She started that when she was 9. So she was put through puberty with synthetic hormones, and education-wise, she really hasn't struggled as much as her brother. Our middle son has seizures, is speech and language delayed, intellectually disabled. But, you know, he has a full-time job. He just started driving. So he does have some delays, but, you know, our daughter lives independently. Garrett will definitely be able to live independently when it becomes that time. And then our 16-year-old also was diagnosed prenatally, but does not have really any of the deficits that his siblings have, and they've all followed the same diet their whole lives. So it's kind of odd having 3 drastic differences in their deficits, and you know, and every child's different, but having 3 with the same genetic disorder, following the same diets, following the same doctors, following the same therapies, and having 3 completely different outcomes with all of that. So has been interesting. All 3 of them are in the trial. Our 2 older ones have been in the adult trial since it started in September of 2019. And then our youngest started in the pediatric trial in the last summer. So we did part B with him. So, you know, it's, you know, like it said, it's been an interesting journey, but we're always trying to do the best we can for our kids. So thank you for allowing me to be here today.
Thanks, Heather. And Tiffany.
Hi, sorry I joined a little bit late.
Okay.
I have a 9-year-old daughter with classic galactosemia. We found out on day 6 of her life. She has kind of followed similar trajectories as a lot of kids with classic galactosemia. Like, it started out with every milestone was just a little bit later than most kids. You know, but she did eventually crawl and walk and do all of those normal things. But then she wasn't talking. She had a pretty severe speech delay, which now is diagnosed as apraxia, and she continues to struggle with motor speech issues. And now that she's in school, she's very behind academically. She's in a special ed program now where she gets a lot of extra academic support. She does not qualify for intellectual disability, but she's pretty borderline. Like, she has all the specific learning disabilities. Like, she qualifies for all of like dyslexia and dyscalculia or whatever those are called. And she doesn't have any tremors, but all of the all the cognitive function stuff is definitely present with her.
Okay, thanks, Tiffany. So thank you all for sharing. I'll share. I've written up some of the questions. Maybe I'll flash them onto the screen from time to time, and then we can have a discussion. The host has disabled participant screen sharing. I need to be able to do that. Let's see. Trying to think where that is on the. Does anybody know offhand how the host can turn on screen sharing?
It's me. I have to do it. And then for some reason, it's not letting me do it.
Does anybody on the call know how Nicole does that?
Larry, could you send your slides to Nicole and let her put
No,
them up for you?
That even says it for myself, that it disabled the screen sharing, and I did not do that.
It's really disabled.
I do a lot of Zoom meetings. I've never seen this before.
Okay, that's okay. We can go ahead with that. And I just want does everybody know Brittany and Nicole, or would you guys like to introduce, do you know some of these folks better than others? Would you like to introduce yourselves?
Yeah,
we can do that.
Brittany, why don't you
I'll
go ahead?
go. Yeah, well, I'm a mother of 4. I'm Brittany, and I currently am taking care of all of them. That's why I'm taking my video off so that I can listen, but you guys don't have to see the craziness here. But I currently sit as the vice president of the foundation, and we're doing a lot with Larry, just in talks with the FDA. And so we really appreciate you guys being on this with us. I have 2 of my 4 children have galactosemia. So my 3rd daughter has it. She's 4.5, and she is currently in the clinical trial. And my youngest daughter, who will be 6 months this weekend, also has classic galactosemia. So I come from a perspective of in trial and out of trial. And Ansel, my 4.5-year-old, has quite a few deficits for her age, and all range from speech to motor skills to cognition, all the things. So I look forward to hearing you guys today, just discussing. And again, thanks for being here.
Okay, thanks, Brittany. And Nicole, do you want to introduce yourself?
Yeah, so my name is Nicole Casal. I am from the Albany, New York area, and I have 3 children. Joseph is my middle child, and he has classic galactosemia. He is going to be 10 like in a few weeks. So, typical, early diagnosis of like 5 days, switched to soy at day 6, became septic and meningitis around day 9. So that rough start that a lot of people have also encountered. Today he's doing fairly well. He does receive a lot of services at school. He definitely struggles. He's, his borderline for the IQ, he's around that 75 range, some neurological cognitive issues. And so like right now he's in a regular classroom where he gets pulled out or they push in. I'm not sure if that's where he's going to be next year, because his teacher suggested a self-contained classroom with a 15-to-1. So we're kind of grappling with if he would do better there or socially sticking with the class that he's in. So definitely the learning, the cognitive, and a little bit, I think we're starting to see depression as well at this age, which is, sad, obviously, because it's very young. But now he's definitely noticing like that he's not quite where his peers are. So, and that's Jojo. Other than that, he's very social. He's got a very unique personality. And he's usually like the mayor of the classroom. So of everyone you meet, Jojo's the mayor. So that's me. And then Larry, do you know if you've got access now?
Let me see. 1 second.
It's on there now.
Okay.
Yeah, we can see your screen.
Okay, great. So the first topic, we'll talk about some of these topics. We'll kind of go in and out. Don't feel like every single person has to answer every single question. This will just kind of a discussion. some of the questions you might relate to better than others. So the first thing that we're going to talk about is, so, some of you, as you introduced yourselves and your families, some of you started sharing already about what some of the symptoms that you see in your kids or in yourself. But so this is the first question I'd like out of those symptoms. What are the most impactful symptoms? So what are your top few symptoms that either you or your child experience? And why is it that those symptoms are so impactful? So would anyone like to answer? Go. Let me see. I'm just gonna. Okay. So does everybody have that question in your head? I might stop sharing so I can see your faces.
Larry, if you want to keep
That's what I
sharing,
was
I
thinking.
can call on people.
Okay. Or well, I think it's a simple question. So yeah, let's see. Okay, raise your hand if you wanted to. Okay. I think first I saw Amy. Go ahead, Amy.
So my son is in kindergarten and I see a lot of issues with speech, but a lot of learning issues. He's in kindergarten and he's struggling to know about 8 letters currently. And his handwriting is really, really difficult. He doesn't enjoy doing that at all because it's so difficult for him. And I think that, being in kindergarten, it's such a detrimental time where things should be moving along so much more quickly. And he's just kind of lagging behind. They have put him in a special classroom. And I think there are only 10 students in that room. And I think they actually have 4 adults to 10 kids in that classroom, which is great that he has that support. But it would be amazing if we could get to a point where he didn't need that kind of support. So some fine motor skills, his gross motor skills are pretty good, but occasionally we see some issues where he just can't quite figure out how to move his body the right way. Another thing I see is kind of a behavioral issue. When things get frustrating, they are really over the top frustrating, and helping him to just kind of come back into a place where he can be in control and really relax and realize that the thing that he's frustrated with really isn't that major of a deal, but helping to him to understand. I see that not just a daily basis. I would say I see it probably 4 to 6 times a day, that we have to kind of reel him back in from some sort of frustration, that something that was difficult for him.
And Amy, what do you feel? Do you feel like your son is aware that he's having trouble learning letters and that he's in this special class with other kids? Does he have any consciousness, or is he still too little?
I think he's too little to really understand that this isn't what is normal. That's my guess anyway. It's hard for him to express that to me if there is a different thought.
Okay, thank you. Tara.
Yeah, I can jump in. And I think this will be a good kind of similar, Amy, too. And I know when we were in the trial, we kind of saw, right? I saw a lot of Joey in your younger, in the younger version of your son. Yeah, for me, most impactful symptoms definitely is that language comprehension component, right? I think a lot of the speech stuff develops holistically into the language comprehension, memory retention. For us, it's most impactful because it impacts his day-to-day living, right? And it also impacts us as a family. We're constantly, whether it's at home, whether it's at school, whether it's we're out, we're constantly on top of him because he doesn't know how to have those conversations, right? The community conversations, the answering questions. So there's a lot of prompting. There's a lot of, we insert ourselves to help direct him so that he doesn't feel uncomfortable, right? So that he can quote unquote be normal. So it's really impactful just to him on a personal basis because he struggles there, but then holistically to our family, I really think that's the biggest impact. That, and even Amy alluded to, like that special education class, that dependency, it is really existing. And Joey's had that since, the start of school, and he continues to have it. And we're actually having conversations now to even increase that dependency. So for Joey, it's been a constant since he's in school, outside of school. Really making sure the impact of the life skills, how he needs to live life is our goal, right? And that language comprehension piece really impacts it.
And Tara, Joey's a little older than Amy's son. So how is this impacting his social, kids at 11
Yeah.
are starting to be a little more social?
Joey, and I it's funny because when you hear the galactosemia, you kind of hear both sides of the spectrum. Joey is very outgoing, social, has no issues there. There's no behavioral issues. Everybody loves Joey. Joey loves everybody. He makes friends easily. Joey doesn't think he's different at all. Joey just thinks he has allergies. Joey also does have tree nut allergies. So, and to be quite honest, he's anaphylactic. So we're like very on top of that also. So that's another component for Joey. Joey doesn't think he's any different. He says, Mom, my brain works fine. Why do I need to do all this? He has no idea that he's different.
Okay.
And I think that stems from some of our parenting and how we raise him, right? We don't want him to think he's different. He's not. In our eyes, he's living a different kind of life than somebody else, but he's his own self, and he's not. That's okay. So we encourage that.
Yeah. Sure. Kelly?
Yes, so Zaria, she's 10, and I've had similar issues with Amy and Tara. Kindergarten was a nightmare. It was just, and I think the biggest thing was, I'm in Indiana, Lafayette, Indiana. And I've always thought, they were backwards on everything here. Oh, we've never heard of that. We don't know what that is. We can't help you. So kindergarten was a struggle, and she got behind because I wasn't able to get the tools that she needed in school. So she ended up being behind. And that was very frustrating for her and me, because she had a problem with focus and staying still. She's very outgoing, makes friends like you wouldn't believe. And, but she had an issue with staying focused, and reading was hard, cognitive things. And the teacher's like, oh, she's going to be fine. And she ended up getting behind because they just weren't supportive. And it was an impact on my other kids. I have 4 other kids of my own, and these are my 2 grands. So it's trying to help her and put the focus on her most of the time, spending a lot of time at school, just trying to teach the faculty on what galactosemia is. Oh, it's not just a milk allergy. It's so much more than that. And they would keep, oh, she's just allergic to milk. And, they were giving her foods at school, and I would be livid, and just ignoring what I'm saying to them. And, oh, it's just in that, lactose intolerant or whatever. So that was major. That was so major. I was constantly going to Riley Hospital, getting doctor's notes and faxing and all these things to get her to the point where she is now. And I'm always honest with my kids. In the beginning, she didn't know what was going on. She knew she was different. But, I always encouraged her, hey, you're not different. You have to live a different type of lifestyle, but you're just like everybody else. You just have to eat differently. So that was probably the biggest thing was, she had the behavioral thing, and the diet was really restrictive in the beginning.
And tell us more about the behavior. You said that she had some behavioral issues.
Yeah, it was just crazy. I think because of her frustration.
Yeah.
Of not being able to, when you first start, she first started kindergarten, she's just, but after a while, I was like, I'm not catching on to nothing. I'm not, everybody's reading and I still can't read, and, what's wrong with me? And so she started to act out, and it was difficult. So then they wanted to label her as this bad kid in class.
Right.
So again, here I am with all my 9 notebooks of paperwork and research and trying to teach them what galactosemia is, and it's just out of control, and she's just not getting the help she needed. And of course, I can't be at school all day, which I
Right.
was spending so much time there at school with her, trying to keep her on task because she wasn't focused. She'd be like, oh, well, I can't, I don't know what's going on with me. I can't learn this stuff. And she would have this defeated mentality of, I can't learn.
Hmm.
And she would get in trouble. And
Yeah. And Kelly, you also mentioned, I think when you did your intro, about bone issues.
yes,
What was that? What happened there?
her elbows, and they called it nursemaid elbow or whatever, would pop out of joint all the time. The first time it ever happened, she was probably early on, and I would take her to the hospital because I didn't know what to do. And after a while, I learned how to put it back in myself. It was just traumatic for me and her, because I was doing this for years. And, I was trying to avoid surgery, but it would happen at school. She'd be playing on the playground and her elbow just popped out of joint. And it went on for years until she's probably about 6, but she still has some issues with her. It's just her arms, not her legs or anything else, but every now and then she'll have some pain, aching going on in there.
Okay, and that's galactosemia related, did the doctor say?
That's what they told me, but they said, oh, it'll clear up on itself because she's not getting the vitamin D. So, she's on the vitamin D supplements regularly now, and she had been since that started to occur. But in the beginning, it was all the time, probably 2-3 times a day that her elbow would just pop out of joint. She would just be screaming in pain all the time.
Wow.
And so, yeah, it's cleared up. Her bone scans, she started doing the bone scans last
Maybe
year.
as she grew, huh? Yeah.
And so she seems to be doing better with that.
Okay. Anyone else? Top symptoms? I actually saw Trisha's hand go up first, Tiffany, then I saw Tiffany, and then Kimberly. So Trish?
Yeah, so this came to mind when Kelly was talking about the bone things related. I was recently told, probably about a year ago, that I've essentially gone through menopause, and at 27, I have like the risk of osteoporosis of someone in their late 50s, early 60s. So I am also on calcium and vitamin D supplements. And I have been for as long as I can remember. I got an ADHD diagnosis when I was 22. So that may or may not have been related to galactosemia. That was just a very late diagnosis. And just kind of the other things that have directly impacted me the most, I don't have access to any kind of endocrinologist that isn't pediatric. So since I turned 18, I haven't been able to really get a medical opinion on what's going on, and having to explain my own diagnosis to every doctor I see. It can get pretty frustrating.
And Trisha, how is this, like, did they say you're actually going through menopause?
Yep, they said that they looked at my progesterone levels, and I think they said on the high end, they like to see it like in the 30s or something. And I was like way out. I was like 162 or something. So I've effectively gone through menopause. If I want to have kids in the future, I would need to go through like finding like a surrogate and everything. And yeah, that
How's
was
it feel? What was that like to learn this at your young age?
I haven't been too interested in starting a family, so it was kind of a mix of a relief, but also it felt less of my own choice when I got the news, not really any kind of diagnosis, but with my ADHD, I should be taking hormone supplements every day, and with ADD, it's hard to remember to do that every day. So that kind of one thing impacts another, and so if I forget to take it, then my bones feel the effects, my everything else feels the effects of me forgetting to take that because of my cognition issue.
Yeah. And having osteoporosis at a young age, how has that impacted your life? Or are there things that you have to do differently? Or are you more cautious? Or like, have you had broken bones or?
I haven't had an official diagnosis of osteoporosis yet. I was told that I am at a higher risk for it.
Okay.
And my bones will probably start to deteriorate sooner in my life than average.
Okay. Okay, thanks, Trish. Tiffany?
Yeah, I'll keep this short. I basically agree with Tara that.
Tiffany, we got
okay.
lots of time.
All right. I would say that the most impactful stuff is definitely the language and the cognition. And it's because it's the thing that affects her access to life the most, like her ability to participate fully in life. Like it affects our family, like the games we're able to play with her. We're constantly trying to think of ways we can include her in what we want to do as a family. And if she was able to learn things faster, we could play more complex games. Like if she, because of this language disability and just learning disability, I feel like as she gets older, her friendships are still simple, whereas her peers have more complex friendships. And I think she's just going to kind of get left out of life a little bit more as she ages. And that's what concerns me the most.
Okay. I think Kimberly, I think you were next in the queue.
So I think with different ranges, you're going to have some different symptoms, because I had a whole lot of symptoms at birth before I was diagnosed. But like as an adult, I sometimes think, maybe I should have continued with college, but I really didn't have, I really struggled with school. And then I did have the ovarian issues. And so I didn't find out that I was infertile until I was 21, and I was thinking about starting a family. So that was a big impact on me at that time. And I know a lot of the other adults, sometimes it's hard for them to realize that they're infertile. I did end up adopting 2 children. And that was one of the best things for me. It was, it still is kind of hard, when they need help on their math or different other things. I usually have to send them to their father for help. But my children are pretty smart, and they can do well on their own. And then I I have to agree on the bone issues. I've had vitamin D deficiencies. I've had osteoarthritis, and then like a low bone density.
And Kimberly, we have your adult perspective. What was the hardest part when you were growing up as a kid, when you were little?
That also had to do with my my learning problems. I was trying to catch up on schoolwork. It took me hours to get my homework done, and my siblings were all in A+ classes or gifted classes, and I never saw them doing schoolwork. And I was like, wait a minute, you don't even do homework, and you're in a gifted class. And it just it was just hard for me to get my schoolwork done, and I did struggle with my grades.
Okay, thanks. Anybody else? Heather?
Hi. With 3 kids, all different levels, one of the things I'll agree with the speech and language aspect, and I apologize, I am at work. I'm sorry. I'll have to come back to you.
Okay,
Hold on just a second.
sure.
I'm sorry. Is it okay to talk now?
Oh, yeah, go ahead.
Okay, I'm sorry. I apologize. With our middle child being having severe speech and language delays, listening to some of the other parents talk about the frustrations and if they feel like they're part of a group. And I think my kids have been very privileged to have a very, very small school. So our oldest, sometimes she had 6 to 10 in her class, and that is a normal educational setting. That is not special education. That is just how big her classroom was. So they were able to get the extra assistance they may needed without being pulled out or feeling different. With Garrett, his group of friends he's had since preschool, he still has as an adult. They still get together on a regular basis. And we see it a little bit the other way, where they are his protector. They want to talk for him. They want to protect him under all costs. And so they were talking for him and not allowing him to do his own talking. So through school, he's very social. He's very outgoing, very likable. He was voted homecoming king his senior year. He is just a great kid with speech delays. And so I know previously somebody said, their parenting technique, has helped them. And I truly, honestly believe the village that surround my children, my husband and I, we do not look at our children with galactosemia. We look at our children as amazing, kind, considerate, intelligent individuals who happen to have galactosemia. It's one aspect of their lives, but they're brilliant children. They're brilliant kids. They're kind and they're compassionate. And so we try to look at it a little bit differently. But through all of the services and all of the things that have, I think, impacted our daughter the most is constantly feeling like she's different growing up, because her friends were starting to develop and starting to cycle. And, that's a big thing in junior high, when who has done this and this and this, and that wasn't happening for her. And she knew why. And then keeping those friendships where she constantly felt like she was different, and trying to then confide into people she thought were her friends about her differences, and then being made fun of, because kids are honestly just mean. At the end of the day, kids can be so incredibly mean to each other. And sometimes they don't even realize how mean they're being. And I would say anxiety and depression is a thing that, she definitely has to deal with, just because she wanted to be a mom. She wanted to have that opportunity. And sometimes she does feel like that's been taken from her without her choices. But there are other, and we've always addressed it as there's other ways to be a mom. Adoption, Adoption is an amazing thing. Congratulations, Kimberly. That's amazing for you and your family. That is amazing. And I hope someday that I get to be a grandma, because I want to be a grandma. I can't wait. But for her, that's something that's really, it's been hard for her, and it has caused her some anxiety and depression dealing with those things. With our middle child, with his seizures, I think the seizures has been a bigger impact on his life than his speech and language and intellectual disabilities. And that's life-changing when you don't know when that's going to happen, or you don't understand why your body's doing this, or when he comes out of a seizure looking at us like, what just happened to me and who did that? For the longest time, he would come out of a seizure and he would be angry at me because my face was the first face he typically saw. And so he thought maybe I had done something to him. What did you do to me? And why do I feel this way? And later he would say, well, no, I didn't. I'm not mad at you, Mom. But that was his instant, like looking at me like, what just happened here, and not really understanding that.
Heather, how common, you're the only, no one else has mentioned seizures. I was just wondering, how common do you know are seizures with galactosemia? Like what percentage, or do you have any idea, just to educate me?
Well, that's a good question. And I think when we first started going through this with him, they immediately said, oh, it's the galactosemia, that's why he has these seizures. And we were like, how many people with galactosemia have seizures? And we were being told very few. Like, we don't know that many. But then when we started with this trial, we're finding that it's actually more common than we were told in the beginning. I can't honestly give you a scientific number because I've never been really given one, but I think it is more common than we had originally been led to believe. And kind of going through this trial, we figured out that, the natural galactitol building up in some kids, it builds up differently, and Garrett's, it's building up in his brain, which is then causing the seizures. So it, without going into all the gory details about being a parent with a child with seizures, it's not something I wish upon my worst enemy to ever have to go through that journey with your child. And having those at school or having those in a public place, I think that trumps his speech and language delays, because he has had amazing speech therapists that have helped him not get frustrated. Now, I'm not going to say he didn't get frustrated, because we went through several years of absolute terror because he didn't know how to communicate those frustrations with us. So we actually sought out a behavioral counselor who worked with my husband and I to help him understand that everybody gets frustrated, and let's figure out how to relieve that before you get to that point that you just shut down. Again, not easy. And everybody in the discipline picture, meaning my husband and I, we had to be on the same page at all times. There was no wavering from that. And it was hard, but now I have a 20-year-old who is not a behavioral problem, graduated very successfully from high school, has a full-time job, and is an amazing kid. And he never has been a behavioral problem at school, because, we worked with him to know that everybody has bad days, everyone has terrible time, but you don't have the right to take it out on anyone at school, that you need to come home and talk with us, communicate with us. And that was hard, and it was hard for him. I'm not going to lie, it was hard for all of us. And but I do believe that was one thing we gave our son to make him more of a successful adult, because he wasn't struggling with behaviors during school. He was able to learn, he was able to concentrate, he was able to pay attention, he was able to build those bonds with his friends and keep those strong friendships, where he wasn't being isolated out, because again, kids are mean. If you have a child that has some behavioral things, sometimes I do think that they're, the teachers are isolating them out, that they're a behavior problem, or they're pushing them to the side, they're a behavior problem. And then the kids are doing that. And the kids are doing that because the person in charge of the classroom is doing that. Yeah. So, and with our youngest son, he doesn't have those, deficits. He doesn't have the deficits that his brother has, but he also, he doesn't struggle reading. He's advanced in some things, but he struggles in math. But I think with him, sadly, he didn't like those pull-out times to get that extra assistance. That's what made him mad. He got mad because he was being pulled out when he just wanted to feel normal. He would get pulled out for those extra assistance times, and he would get mad, and he would come home and he would say, "Why are you doing this to me? I wanted to be like everybody else." So he was more angry at me because I was trying to get him extra assistance, thinking I was helping him, and then we were causing these problems. So, having three, and they're all different. And I, I'm kind of at the end of raising mine through school, so I'm a little different stage than some of the other ones, but
Okay.
they're all different. And I think too, where I'm from, our class sizes are a lot smaller. And we were not afraid to seek outside therapy. So Garrett and received speech therapy through our local area education agency, where they come to the school and give services for occupational therapy, a whole gamut of things they can do. But we also sought outside speech therapy. He had private speech therapy. We did virtually speech therapy. We did all these things extra. We were not afraid to seek outside therapies to help our kids, because sometimes our schools are just overwhelmed, and they do the best they can.
Okay, thanks, Heather. It's interesting to hear the perspective on having three kids with totally different presentations. I mean, I'm getting an appreciation as you're all sharing. I wonder now, Don, do you have two kids maybe with different perspectives?
Well, a lot of the same themes. Noah is not quite 3. So he was born actually the same day of 2 of his cousins.
Oh, wow.
And so we have, but unfortunately they're quite at different places in the country, so we don't see them as often. But so we've been able to judge his developmental against them, I guess, to some level. He walked before any of them did. And he was actually starting to, say words and so on at the age you would expect. And then there's been a regression. So we got him into speech therapy. He's had tremors from the very beginning. They haven't gotten really a whole lot worse. But, his hands shake from time to time. His speech is coming along. He's behind. He'll turn 3 at the end of May. He is saying words. He's putting some together, but he's very hard to understand. He's well behind his cousins, in that respect. Now we had girls, so this is the first opportunity to raise young boys, and they are different. And he's got a tremendous amount of energy. He seems to be able to understand everything. And he seems, his motor skills and fine motor skills seem quite good. So it's still early, frankly. We're just monitoring and hoping. He does have a lot of the same behavioral discussion, issues that I've heard of frustration. He gets, he's in his kind of terrible 2s, but it seems extreme at times, and I think it's a communication issue. He knows what he wants to say, he just can't say it or can't get your attention. His nose was bent out of shape when his brother Carson was born. He's now 14 months. Carson's a monster. He's like 95th percentile in height and weight. He's a big kid, and so far hasn't. He walked early as Noah did. Both of them walked at like 9.5, 10 months, and Carson is very different personality, but so far we really can't tell and baseline him yet. So we're just monitoring things very, very closely.
Okay, thanks everybody. This has been really interesting. I feel like we're painting a picture here. I'm going to share my screen again. Wait. Okay. So now I'm going to introduce this question a little bit. So sometimes in diseases that are more common that, affect hundreds of thousands of people, they're very well studied before treatments for them are made available to the public. This doesn't necessarily mean that they are guaranteed to be completely safe, nor that you as a patient or a caregiver would necessarily accept the risks in order to obtain the expected benefits or the potential benefits of the new treatment. It does mean that the decisions to approve, to prescribe, or to take such drugs are better informed than is possible with the drug developed for a rare disease like galactosemia. So I'm going to shift gears here a little bit to thinking about gene therapy. When you get a gene therapy, it goes into your body, and once it alters the genetic makeup of the person, there's no turning back usually. It's kind of a new field. We're still learning a lot about it, are there off-target effects that the gene therapy might affect? So this next question that I'm posing to you all is, if a gene therapy were in trials for galactosemia and it had never been studied in patients or just a little bit, how likely would you be to try it? And why? Let me see if I can get back to the
Maybe
Zoom. Yeah, sure. Anyone.
I think that's a really good question, frankly, and I think it may depend on many things, but I know we've discussed it quite a bit as our family. Aside from my daughter and son-in-law, my son-in-law's father is a pediatrician as well, and so we have that added benefit that he sees the boys on a normal basis. And as what I understand with gene therapy, they do a lot more animal studies, mouse studies, and so on for a much longer time than you would do on a normal, pharmaceutical drug. And I think then, as they go through the dosing exercises, they plan to start with older patients. But ultimately, in speaking to the two gene therapy companies just in the last month, both of them want to target as young patients as possible, for all the reasons that we've spoken about. So I think it will depend ultimately on what we hear from, but we'll have to likely make a decision. Do we want to be part of that clinical study or not?
And what's going to go into your decision making? How are you going to decide? Say that it was, made available.
Yeah.
And they reached out to you. How do you decide? Are you likely to take, are you more likely to take it? Less likely, or like not at all until it's like a certain number of people have been studied? What goes into your family's decision making?
Yeah, and we haven't had to make that, Larry. So I'll just say that at this stage, we'll try to be as informed as we possibly can on the side effects, if there are known side effects that could come about. As you said before, once you do the gene therapy, you're kind of stuck with it. Plus, there isn't always, they're still working on how do you do, if there's a booster concept possible, right, because there are issues with that as well. So I think it will probably be very interesting on where the boys stand at that time. Now, it's probably a couple of years before, at least a year and a half, I think, before we'll even have an opportunity to make a decision on a clinical basis.
If it was ready to go right now, do you think you'd be on that scale from very unlikely, somewhat unlikely?
I would say that we're probably fairly likely to try it.
Somewhat likely. Okay.
Yeah, I would say very, very likely.
Very likely. Okay.
Yeah.
Great. Thanks. Tiffany.
So I have emailed Dr. Judy a little bit about this because I know that she has done some studies on her rat model. And she did mention to me that one thing that they're planning on studying is in adult rats to see if any improvements in the cognitive function can be made. And I think for me, I don't think I'd want to be the first, since Charlotte is already 9, and we've been able to support her through life. And, a bad effect could be potentially really bad. But if Dr. Judy's study on the rats showed that like improvements could be made even for adult rats, I think I would be much more likely to want to jump on board.
So what do you think, like, Tiffany, if it was offered in the next like month, where would you fall on that? Very unlikely, somewhat unlikely, unsure, somewhat likely, or very likely?
I would say somewhat likely.
Okay. And
I'll
that
jump-
would be anything that could influence that?
I mean, I would want to see what happens to the adult rats,
yeah,
to
okay.
see if like, the brain could repair itself at all, or,
Okay. Great. Okay. Next, who's?
Yeah, Tara, this is Tara. So
Yeah,
I think
Tara.
it's hard, right? We're in a hypothetical situation, obviously. But right, so I don't know that much about, I know the concept of gene therapy. That's pretty much all I know at this stage of the game. I think for me, to answer your question though, if it had, like, I know it's a trial, but if there was a direct benefit to Joey being in that trial, knowing that it will impact him personally for gene therapy, I think I would be likely to do it. If I didn't know that, I think for gene therapy, I would be very unlikely to have him involved. Does that make sense?
Okay. So it would be very unlikely unless there was evidence.
Yeah. Does that make sense?
Yeah.
Yeah.
No,
Okay.
it's a little bit, I mean, it kind of fits in a little bit with Tiffany. Your kids are similar in age, just off by.
Yeah. And we've spoken about this offline as well. So yeah, I think it's hard, right? Because we know our kids are at a point that they have impairments that will impact their future, right? So
Yeah.
if we can correct that, and if gene therapy does that, I'm all for it. But I have to know that in order for him to participate in that.
Okay. Thanks. Anyone? What about Trish or Kim? Are you guys, you've lived with this for a while. How does this hit you when you hear the words gene therapy?
Actually, for me, it's something that I would be fairly likely to do. I would want to know more about the risks first, and I just feel like at my age, it's probably worth a shot to try something like that.
Okay. Would you be worried about taking a gene therapy?
A little bit. That's why I would want to know more about the risks.
Okay. Okay. Trish, I'm sorry I'm calling on people, but I'm kind of curious about your perspective.
Yeah, I have kind of, I think, a unique situation. From the people I've talked to before, I haven't had any significant issues when I was growing up until I was on artificial hormones. I never had tremors. I attributed my like slowness with reading with ADHD. But at the same time, I was still put in the more advanced classes in school. So I think had it been available when I was in school, my parents probably would have passed. Because the strict diet was working for me. But now, as an adult, I would be curious to, I would definitely want to learn more. I would want to be more confident that it was safe and to really know what other effects it would have, but I would definitely be curious.
So would you be the somewhat likely or unsure?
I'd probably fall more into unsure right now.
Unsure, okay. Great. Yeah, thanks. Amy?
I think at this point, I feel like I need more education on the whole topic of gene therapy. The idea that once you started, it's kind of a no turning back. There's that's I think a little more frightening because when you have something, say like the treatment that Applied Therapeutics is doing, you can always stop, but the whole no turning back thing, that's a little that would make me hesitate. Definitely.
Okay. So would you say that you're somewhat unlikely or very unlikely?
I would say somewhat unlikely. I can be persuaded if you give me enough information and if I were able to see that the outcome, it could bring a significant potential for my child, then yeah. So I would say at this point, probably somewhat unlikely, but I think with enough education, perhaps that I could change my mind.
Okay. Could change mine. Okay. I don't know if Brittany or Nicole, if you want to weigh in on this one.
Similar to what others have said, definitely would need more information, but I feel like I may have a little bit more information on, some long-term complications, and that it would make me a little more likely to move forward with it.
So would you be somewhat likely or very likely?
Somewhat.
Somewhat, okay. Brittany, did you want to?
Yeah, it's definitely something I've been thinking about, especially since there is a clinical trial for one child, but not the other at this point. I would say I'm somewhat likely.
Okay.
I still haven't been 100% convinced. However, I would say that the benefits that I've seen of gene therapy and other genetic stuff is really convincing that it would be worth it, as long as safety and all the typical things you hear from parents as far as gene therapy goes, with it being such a new technology. But I think I've fallen somewhat likely.
Somewhat likely, okay.
And I think I'll throw in a plug for conference, that there's going to be a lot of good information out there about.
Great. Great. Did Heather, did you weigh in on this? I'm sorry, maybe she's.
Sorry, no. I haven't thought about it. With having 2 adult children, that would be something that they would have to make that decision for themselves. I can say that again, we would we would assist with weighing the risk of that. But I know our oldest, she would be more than likely to try it if she would be very likely to try it. Garrett might be a little bit more apprehensive just because the severity of his seizures when he does have them. We always look at, is that going to cause them to come back? Is there going to cause them to be worse? So that we might be a little bit more apprehensive without knowing more, but I know our oldest, she would want to have everything laid out in front of her, but she more than likely would definitely be interested in it.
Okay. Okay. Thanks, everybody. That's been really helpful. Okay. I'm going to skip ahead a little bit. There's one question that I really wanted to get to. Okay, so this question, there's one of the ways that the FDA can approve drugs is something called accelerated approval. It means that they can approve a drug more quickly because they're not waiting until they see clinical changes. Like they wouldn't have to see improvement in someone's learning ability, cognitive skills, that kind of thing. But they could actually approve the drug if it changed something called a biomarker. A biomarker, like in galactosemia, something like galactitol, galactose 1-phosphate, or gal-1p, galactose. These are, some of the enzymes that are off in galactosemia. And if the FDA thought that improvement in these biomarkers would probably mean that down the road, maybe in a couple of years, it might take that long to see a clinical change, but they still might approve it on accelerated approval. But one of the things is if a drug is approved by the FDA with accelerated approval, the company, it's not a full approval. After the drug gets approved, they have to continue studying the drug for those next few years to see if it actually does what it says it's going to do. If it doesn't do those things, FDA can actually take the drug off the market. Okay? Does anyone have any questions about that? Just jump in if you do. So, okay, so one of the questions that I have to all of you, would you consider participating in a clinical trial that measured changes in one of these biomarkers to show that the drug was effective? So it would not be showing clinical benefit, but it would only be showing that it improved one of these enzymes or, in your blood. And then once if they FDA approved the drug, would you take that drug or give it to your child, even if we didn't know that it improved symptoms, but we know that it changed like galactitol levels? So let's go to the first question first. Would you consider participating in a clinical trial? I'm going to stop sharing again. Okay, so did someone have a hand up? I didn't. Tara.
So my answer to the first question would be yes.
And why?
So I guess it's safe to say we're a part of the clinical trial that's currently underway. So that's kind of, that question is what the trial is right now, right? So for us, it's worth the risk, right? It's worth us seeing if it does make an impact. We were okay with taking the risk.
Okay. Anyone else? Kimberly.
So I've been on the clinical trials, and I've always been okay with those risks. And I would do something like that.
Okay. I guess if you're in a clinical trial like that already, that answers your question more strongly. I believe you do more than anybody else.
Well,
Don?
and I've had I did one part of the study, and then after that part ended, they called me later on and asked me to do a second part. And I'm actually kind of on a second part, but the problem is some of my lab results have been a little bit off, and I'm kind of on a pause with this study.
Okay.
But I've kind of been wanting to get back involved.
Kim, can I ask you what motivates you to stay? You sound very motivated. What's behind that motivation?
I just, my age, I just feel like not only people of my generation can get some sort of a drug, but people of future generations. And the only part is that I am kind of hesitant about the accelerated approval because of the issues I've been having lately with the drug study. I feel like some of those some of those things need to be solved before it actually gets approved.
Okay. Okay, thanks. Don?
Yeah, I think our answer is absolutely yes, at least on the current one. I think it maybe depends on which biomarker, is selected, but we were impressed with the relationship that applied therapeutics showed between galactitol and disease severity, which was a very strong correlation. So I guess we're hopeful if we can reduce galactitol levels that will ultimately, help, especially the boys at the early age they are. And we weren't able to get into the study just because Noah wasn't 2 yet. But so absolutely, we would pursue that.
Okay. Heather, did you have your hand up? Heather?
So my 3 are also a part of the current study. Just a little bit of, so, each of them got to choose whether they did it or didn't do it. Our oldest being female, obviously all the female issues that come into it. She knew at her age, she didn't have high expectations that things could be repaired or changed for her. She decided to do it solely for the fact that she hoped that no other mom had to set her daughter down at the age of 9 and tell her the things that I had to tell my child. She said, so if me being in this trial helps another mom and another little girl, I'll do it time and time again. So again, I think one of the things that we can all say is our children are amazing. They're compassionate, they're caring, and they think about others. And every child I've met through this journey, they're amazing. They're all absolutely amazing kids.
Heather,
But,
Heather, your youngest son is the least affected, correct?
that is correct.
But he's in the clinical trial. What went into his decision-making?
I have to laugh because his brother and sister did it. He said because they did it. And Peyton, our oldest, she said, I'm like, do you feel different? Let's communicate like what's going on here. And she said, Mom, I feel better, and I didn't even know I didn't feel well.
Okay.
And that was her. She said, I feel so much better, and I never knew I didn't feel good. And I think with Maxwell, he knows that there are still some things he struggles with, but then there's some things he excels with. And so he really did it simply because he has watched his older siblings go through this. And again, if he can be a part of changing the future for galactosemia, he absolutely wants to be a part of that.
Okay.
And he wants to do better for himself as well.
Yeah.
And for our middle son, he really wanted to do it in hopes that it could change the galactitol levels, things like that. So he doesn't have to have seizures anymore in his life. And that's really why he chose to do it. He really said that I can talk okay. It's just the rest of you don't understand what I'm saying all the time. And so he said, maybe if you all learned how I'm saying, we'd be okay. So, and that's just him. And he's right. If there's times I stop and listen, I probably do understand him instead of saying, slow down, so they did it a little bit for themselves, but a lot of it is to hopefully change the future of treatment for the galactosemia is why they have chose to do it.
Okay, thanks. Who haven't we heard from? Tiffany, go ahead.
So we are also in the trial. So the answer is yes, we would participate in a clinical trial. And the main motivation is just that it's the only way to get early access to a drug that we are interested in taking. And as long as safety is established, which it has been, then I don't really see a downside.
Okay, thank you. Anyone else? Amy?
We're in the trial as well. So absolutely we would try it.
Okay, and what went into your decision making to try it?
I was hesitant at first, and I took the time to talk to some of the doctors who are involved and just learn about what was going on, especially the safety aspect of this particular drug and what kind of side effects, those kind of things. So I felt like after taking some time to learn more about it, it seemed to me that it was worth trying and
Okay.
finding out if it could be something that could make a significant change.
Okay. And Trish,
Yeah, I'm actually not doing the clinical trial now, mostly because I learned about it too late. But if there was a clinical trial to test the levels of galactidol and GAL1P and all that, I absolutely would.
okay. And why would you?
It, seeing as safety has been established, a lot like what Tiffany just said, I don't really see a downside to it, even if there are some side effects that that apply to me as a first-time user of this treatment. Then even if there are some negative side effects to it, I would still be part of like the bigger image of finding actual treatment for galactosemia.
Okay. Okay, and then just to shift, oh wait, Nicole raised her hand. Hi, Nicole.
I just wanted to throw in mine too.
That's so polite. It's so polite.
And I got to figure out how to lower my hand there. I lowered it.
Okay.
So I just want to throw in my 2 cents just because, my son is not on the clinical trial. And really it was because I was very hesitant at first and just not having enough information. And then by the time I did have enough information, that safety piece, the unknown, it was too late and slots were filled, so we weren't able to join. But, would we join? Yes, we would. And with that, the biomarker, just being able to see that things were reduced, that would be a big, even though you don't necessarily know what does that mean in the long run, just the fact that it's reduced, I would be okay with that as long as we've got the safety piece as well.
Okay. And then just to shift gear to Amy, go ahead.
Well, I think I'm going where you were about to say. I was going to shift to the second part of that question.
Yes.
The accelerated approval. I feel like.
But just to remind everyone, so now the drug has been approved. FDA looked at it and said, okay, it does lower one of these biomarkers. We're going to give it this kind of like temporary approval. Would you want your doctor to prescribe it for you, and would you take it? Go ahead, Amy.
I feel like it's one of those things that it's not mandatory. It's not like, the situation with the vaccines where certain employers were saying you must get vaccinated. It's a completely opposite of that, where it's completely voluntary to take this. So I feel like if someone is willing to try it and knowing, the difference too, where with the gene therapy where you can't necessarily go back, you can always try this particular drug, for example, and if you see that it's not working for you, you can stop. So I think that there's a lot more freedom in that.
Okay.
I think that's important.
Anyone else? Would you take it? Don, would you take it?
Yeah, Larry, I agree completely. I think that's what's so unique about this is you can take it, and then if you had significant side effects or any significant events, then you can always stop taking it. The other thing, it is available, just for those of you who didn't make the study, we're pursuing more of a compassionate care process. So that's also potentially available. It's a long drawn out thing, but it is something we're going through and hopeful to get.
Okay. Anyone else? Would you take it? Tara?
Yeah, I mean, we would take it. That's our hopes, right? We want the accelerated approval so that we can try the drug if we're potentially on placebo. So it's, 100% we would try it.
Okay. Trish, I think you raised your hand.
Yeah, I would definitely take it. Similar to what I said before, even if I'm more willing to try this than gene therapy
Okay.
because of I'd be able to stop taking it and things wouldn't be irreversible.
Yep.
And at the same time, I would feel like I'm participating in treatment for galactosemia.
Okay. And Tiffany?
Yes, obviously I would take it even before it gets accelerated approval. So
But you would
Like it-
continue. You'd continue with it once it got the.
for sure, yes.
Even if you didn't see clinical changes.
Well,
So they said that it lowered galactitol. We don't really see but we think it's going to, that's why the FDA approved it, because they think usually when the FDA approves something with accelerated approval, they usually say it's maybe like a 70% chance that it's going to do what they say it's going to do.
yeah, well, there's people in the trial who have already seen some good, amazing results from it. We think that we are on the placebo, so we probably won't get to actually take the real drug until accelerated approval happens. But I suppose if we'd been on the drug for a whole year before accelerated approval and then we hadn't seen any changes, then maybe
Maybe not. No.
maybe we would stop at some point. It depends. If like our insurance company is going to charge us like insane copays for a drug that we hadn't personally seen any results in after being in a clinical trial for a while, then maybe we would change our minds. But without all of that, like if we hadn't been in the clinical trial and we just knew there was this new drug, it decreases a surrogate endpoint. Yes, I'm taking that.
Okay. And
And I
Kim?
think
Oh, sorry.
I was just going to add one thing just on
Yeah.
that, right? I think that's the benefit that we've been saying, right? If we don't see any outcomes as we're on, knowing that you are on the drug based on the accelerated approval, if it's not benefiting, right? Even though the galactitol level I'm just using galactitol as an example, right? But if the biomarker is decreasing and you don't see a change, it's that simple, you can come off.
And how long do you give it?
Well, I guess you would have to determine based on the information that is already there, right? So there's a trial underway. So you would use that evidence of that trial to support what potentially you would say, right? If it's reduced in X period of time, you would hope that it would be the same reduction in your child, but your child's level could be lower. So maybe it doesn't impact it the way that it impacts other galactosemia. So there's a lot of factors, right?
Yeah.
And I think that's part of the research. So I guess the decision would have to be based on prior research evidence from the trial.
Okay.
I
To
would
know
give
what-
it 2 years. 2 years, for
Years,
sure.
okay.
Yeah.
Kim?
So I have had some hesitancies because of the issues, and it's not just me, but there's been a handful of people that I know about that have had some issues during the drug study, but it is always something that you can stop taking. It's a better alternative than the gene therapy when you can't just reverse it or anything. But there has still been a little bit of hesitancy with the accelerated approval. I would like to see some of the issues solved.
Okay.
But if it's a really good percentage of people that are it is actually working for, then yeah, I would want to continue taking it.
Okay. Heather, I don't think we heard from Heather.
Sorry,
Heather's relocated.
Sorry, I'm just leaving work.
That's okay. It's okay. It's all good.
So ask that question again. What was?
Sure. So it was, if a drug was approved by accelerated approval, so FDA said, okay, it changes this biomarker. We don't know if it's going to cause a clinical benefit. We think it likely will. Would you want your kids, would your kids take this drug after it had this tentative approval from the FDA?
Absolutely.
Absolutely. Okay.
They absolutely would try that. And I think the reasoning behind their decision to do that is, even without a medical trial or out clinical trials, my kids point out that diet doesn't always work, and diet is not the end all for them. They have, a spectrum of deficits. They're not the same. Our clinic in Iowa tests the GAL1P levels in their urine.
Yeah.
And with our youngest, we actually thought we were doing things wrong because his levels were so much higher.
Huh.
And we kept thinking, what are we doing wrong? They're on the same diet, all of these things are happening. And come to find out through this trial, we've learned that his body was actually eliminating it better than his siblings.
Huh.
So we weren't doing anything wrong. His body just eliminates better than his siblings. So,
you also see the clinical, he's doing better clinically a little bit too, right?
Yeah. Yes, he has less deficits than, but even I know Kimberly was saying our middle son has had a few issues, some quirky things coming back as far as taking the medication this round in the adult trial, some higher liver functions. I don't know if I can go into all that, but one of the things we found out, is he sticking to what he's supposed to? No caffeine, sticking to those extra diet things during this trial, and found out that he was actually drinking something at work that contained caffeine and he didn't know it.
Wow.
So we've eliminated that, and it seems to be back to normal. So, I do think everybody's different, every human's different, and that's why they're doing this trial, but we would absolutely take it. Absolutely.
Okay, thanks. I'm going to share my screen again. Let's see. Okay, so this question is, when we have some information about the benefits and risks of a drug, another study might allow us to have greater certainty that a treatment is safe and effective. So this would be a different study. To do this, patients would need to participate in these further studies, where for some time, they don't receive the drug under study. For example, they would be on placebo. How willing are you, or you, if you have a loved one, to participate in such a study? So there's a possibility of a placebo arm. It's a continuation study. Would you say, sign me up, or I'd want to learn more to inform my decision, or absolutely not? So I'm gonna get back to our Zoom. Okay, any thoughts about this, about placebo arm in a new study? Go ahead. Kim?
So I think a lot of us were actually on the placebo during the drug study. So I don't think it would be anything that I would be hesitant about doing, because a lot of us for the first phase of the study that I was in, they told us that some of us would not be on the actual drug.
Okay. Thank you. Others? Yep, Tara?
So yes, we would participate. We're currently participating in the clinical trial with that approach. But it's hard. I'm not gonna lie. There are definitely times where I wanna, if we're on placebo, I'm not gonna say whether we think we are or not, but there's times that you wanna pull out not knowing if you're on the active drug, for sure. So we're in it now. My future decision, I don't know what it would be, to be quite honest with you.
Okay. And I mean, like, I don't know, just thinking about it, are there certain things that might impact that? Like, for instance, how long this new study was going to go on?
Yeah, I think that's one of the big factors, right? I think we're already kind of in that stage of the game with the current trial and we feel the impact of it. And my son is a great kid. He takes his medicine, no problem, wakes up. It's a part of his daily routine. It hasn't really impacted his life. You know, he loves it. I got to take my medicine today. He thinks it's a fun game. He loves to tell people about it. But it's challenging, right? It's challenging not seeing the benefit of a drug. So it makes you just question the longevity of it, right? How long, knowing if you're not on the real drug, will you remain in a mindset where you can continue to go that route? Yeah, so time frame would definitely impact decision in a future state.
Okay. Others? Trish, I think, I'm sorry, Trish, I think had her hand up like almost at the same time as Tara. Trish, go ahead.
Having not participated in the current trial, I would say I'm leaning, like I would want to know more information, but having talked to people actively participating in the trial and hearing their stories and getting more information, I'd probably lean more towards, yes, I would participate in a trial for that.
Okay. So you said getting information from other people. What would they have to say to you to make you really want to sign up for this new trial?
I would probably want to know about the risks, and just kind of general safety of the drug.
Okay.
What I'd probably want the information laid out, like this is kind of what we expect it to do in your body, and kind of explain that to me. And the more I know what I would like to go on, like the actual effect of the drug, the more likely I'd probably do the trial.
Okay. Tiffany?
So I have a question, like in this state of the world that your question is, has accelerated approval already happened? And you're saying that I could either have my physician prescribe the drug and just take it, or I could be in an extension study where I might be on the placebo? Or are you saying like the only option is being in the extension study?
I am not sure, Tiffany. I don't know. But this was like just a hypothetical question.
Okay. If the only way to get access to the drug is by being in the extension study, and the chance that there was a placebo arm, then I would take that risk because I've done that before. But it would be, I would not be willing to do that if the drug was already approved with accelerated approval and they were just like asking people to be in the study or just take it. Like I would, at this point, already having been on the placebo for however long, like I just don't think I could do that again.
Okay.
Unless it was the only option, in which case I would do it.
I mean, that makes sense. Because you said you think you're on the placebo arm, so you wouldn't want to.
Yeah,
be on placebo twice.
Yeah, not if like it was available to people who weren't even in the study for part B. You know, if it starts becoming available and they're like, well, since you're in the study, you have to potentially be on the placebo again, I'd be like, I can't do it.
Okay. Amy?
So, I understand how important the placebo is. It's really such a vital part of the study. So I get that. However, it is super discouraging to feel like that's where you are. And I think that's one reason why we are so very much advocating for the accelerated approval program, because we're tired. This little man right here does not like his blood draws, and he's ready for that, to kind of move forward. And I think it would be more hopeful if we felt like we weren't on the placebo. So So would I do it again? Maybe. Would I necessarily put him through it again? Probably not. I don't know. I think, maybe if he had a little bit of a break in time, but I just feel like it's a tough place to be. And knowing that accelerated approval would give a light at the end of a tunnel more so than a traditional pathway would be super beneficial.
Anyone else?
I'll just add, we didn't have that option, but if it was an option of joining a study and knowing that you had a high chance or 50% chance of getting a placebo, I think we would have been willing to do that. And part of it is there's also a 50% chance that you can get the active drug, but you can't do studies in today's world without a placebo arm, and we need as much activity in this area as possible. So it's easy for me to say because as a grandparent, I know all of you, with the blood draws and everything else, not an easy process, but I'd like to think that we could get enough people to support it. And I think my daughter and her husband would have done that had they had access.
Yeah, there are other ways to get, around placebo use. Like sometimes in rare diseases, sometimes we'll put 2/3 of the people on drug and only 1/3 on placebo. So that way you can do that. Or sometimes you can do like a staggered start, like where part of the group gets the drug the first month, part of the group doesn't get the drug till the second, part of the group doesn't get it till the fourth. You know what I mean? So you get to see what people look like when they're off drug, but eventually they get on it, Or sometimes there's things like crossover trials where half the time you're on it placebo and then the other half, you switch. So there's other things that can be done, to help with that particular problem.
Can I add, Larry, that part of it may be if there was confidence, there would be accelerated approval. Because if it's about a question of a biomarker, which shouldn't take years to see, then the confidence of doing that is much different. If the view is it's going to need clinical outcomes with, all the cognitive and behavioral things that are required with the low end could take years, that's a hard road.
Right. Okay. So once again, we're hearing that if it was a shorter study, right, then, and you could see change more quickly, then it's not as bad to be on placebo, maybe. Tara, did you want to? Oh, sorry. You're just. Okay.
I think Tiffany has a question.
Okay, Tiffany.
Yeah, I have just a question since you're talking about it. Is it possible to do clinical outcome studies without a placebo arm? Or would you need a...
Every study, every clinical research study needs a control group of some kind. So you have to compare, how do we know that this drug works and that it's doing what it says it does? So you have to compare it to something. Sometimes, having a placebo is in some ways the most straightforward, because if you see a big split between who got drug and who didn't, there's no better evidence that the drug worked. But there's also things like sometimes doing a natural history study. I know you guys have natural history going on. Sometimes if you can really document how this disease usually progresses, and then you can see that the people that took this drug, you compare them to the natural history patients, and you say, we never see this happen in the natural history study, that the people who took this drug had benefits that the natural history of this disease never sees. But that has to be a really clear cut. That means clinical benefit. You have to see some kind of benefit. So you can do things like that. Once again, if you do this crossover design where half the people get the drug for the first 6 months and half around placebo, and then at 6 months you switch, but nobody knows did you get placebo or the drug? Then you can also see, like, we did really crappy the first 6 months, and the second 6 months, they started this happening, their levels started going down. We saw these changes. And if you can see a robust difference between when people were on drug versus when they were off. That's another type of comparison, but the whole thing in clinical trials is trying to establish the FDA has to be certain that the drug does something to affect the pathway of this disease.
What
And
about like IQ type of things, or like cognitive function? Like, isn't that
Cognitive
pretty
function-
consistent with one patient throughout their life?
No, people,
No?
sometimes there are treatments that can improve, neurologic functioning.
Right. So can't I use my own daughter as her control? Like, from age 0 to 9, she was one way and now she's on a drug. Like, it seems pretty obvious, like if there's improvement.
Yeah, the problem, Tiffany, is that, for each of those ages, you have to establish what's the norm, what did that child function at? And then as they got older, was it just benefit because they got older? And they
Right.
just kind of did, learn more and did things, or was it the drug? It gets tricky. And the FDA has to be certain that they're seeing what they do. Sometimes it's in certain diseases, when you see something that's totally unexpected, it becomes a slam dunk. It's really easy for the FDA to approve a drug. You know what I mean?
Right.
But unfortunately, when I worked at the FDA, we rarely saw slam dunks. Once in a while, you do. Once in a while, the FDA will stop a study before the drug company even says it's over, because they've had an initial look at the data and something has happened that it's like, hands down, we've never seen this before ever, like there's a disease called spinal muscle atrophy. There's a childhood, infancy form, a childhood, and an adult. But in the infants, they all die by the age of 2. And they just start, they're born kind of normal, but then they become floppy. They lose the muscles in their spinal cord and just become a floppy baby. They can't suck, they can't do anything. And then they have to go on a ventilator because their respiratory muscles fail. And then they die universally by age 2. So when a new treatment was developed and kids started sitting up, they were living past 2. It's a no-brainer. It never happens, Let's see, how are we doing time-wise? We only have a few more minutes here. I think that we've had a really good discussion. You guys have been awesome. Is there anything else that you think you can kind of get a sense of what some of these questions are getting at? Is there any last thoughts that any of you have that you would like to add to this discussion? As I said, we're going to write this up. We've recorded this. We'll take notes, and we're going to try to put everything that we heard today into, to kind of get an impression of what patients and families are saying. So any last thoughts?
I would just say that, as it relates to galactosemia, a lot of galactosemia is unknown, right? And I think we're at a change time for galactosemia, right? We're a part of the change. And we all want that part of the change, right? And I think it's really important to emphasize that galactosemia is not about the diet, right? It's so much bigger. It's so much more. Diet is just a component of it, but it really is a neurological disease that really impacts, all neurological aspects. And I think that's important for folks to understand, because the research is not out there, or publications don't point to that. And we can share from our experiences that it 100% is a neurological disease. So it's hard for people to grasp that without living the life of galactosemia and seeing it day to day. So if we could just, help frame what galactosemia is, I think for me, that's the key component.
Yeah, I would add to that, Larry, and just from the standpoint of, I know when Noah was diagnosed, I'd never heard of it before. That his other grandfather, who was a pediatrician, had one patient in his entire career.
Wow.
And so, we also get the feedback, oh, he's, allergic to milk or something, and that also causes all deep concerns with childcare and, daycare and all the other things. But I'll also go to say is I hope the FDA, there's so many rare diseases and they're being discovered and now started to be treated. they have a very, very large challenge, as you know. How can we be confident that they actually can weigh in with the experts that, not only on the clinical side, but the day-to-day side of this? And if that can be communicated, and I think all of us, if we can send that message so they have some empathy for us and they don't consider it just a dietary issue, because diet is insufficient. It allows them to live, but
Yeah.
it doesn't allow them to necessarily prosper.
Yeah, just FYI for all of you, maybe you've heard a little bit about this, but we are planning later this year to have this was just a short, small group, but we're going to have this externally led patient-focused drug development meeting, which is going to be a much longer meeting with more people. It's going to be open to your entire community we're going to have some prepared panelists that are going to speak. And then we're going to have some discussion where people can call in and write in with comments. And the FDA will be in the audience on that day. And we will spend the day, learning, just like we did today. I mean, I feel like I have a better understanding of galactosemia than I, have up to this point. And, I think the FDA will go through a similar process, learning from you. So I hope all of you can, participate in that meeting. And invite your family and friends or whoever to learn about galactosemia. If you've got, some of you talked about, babysitters or caregivers and they don't understand it, it might be a good opportunity to ask, let them tune into the meeting as well. But like I said, this is kind of like a preliminary to that meeting, and you'll be hearing more about it. And there might even be outreach to ask you to be considered to be a panelist or a part of a discussion group or something on that day. But the FDA will be attending and, listening and learning. So, okay, well, thank you all so much. This was, like I said, we really, truly appreciate this, and it's been a great help. And please know that what you've shared today is going to help, the greater galactosemia community. And we will, we're going to put this into a communication to the FDA to give them kind of a preliminary before this bigger meeting in the fall. So
Great. Thank
okay.
you.
Thank you.
Okay. Thanks, everybody.
Thank you.
Take care.
So